Good morning, Wise Tribe. I'm here at Osler Health International. It is Breast Cancer Awareness Month, and I'm here with Dr. Foong. Thank you very much for joining us.
Nice to see you, Anju.
We're here to talk about a little bit about who should be worrying about breast cancer. We've got a really wide international audience in SSEW, all different age groups, all different nationalities. We're here to understand what is the advice, what are we looking for, and how should we find it. So, Dr. Foong, let's start at the top. Who should be concerned about breast cancer? What kind of age group are we looking at?
I think all women should be aware of breast cancer because breast cancer is the most common cancer in women. It actually makes up 1/3 of all female cancers. A third. And the number of cases are, certainly increasing now. We used to see breast cancer as common in women who's gone through the menopause, but we see more. We're seeing increased cases in the premenopausal women as well.
So particularly in that age group, or is there an increase across the board?
It's an increase across the board, which is why we hear so much more about breast cancer. We hear about younger women getting breast cancer, but that's actually because the total number across the board, 30s, 40s, 50s and beyond, is increasing.
So when should we start being sort of alert about it and looking for it in our own bodies? When should we start worrying?
So we talk about screening generally starting from about age 40, but you'll see that some screening programs in the world say start screening at 50. And 50 is actually because it's a nice round number and we're looking at the age of menopause. So 50 is chosen as the average age of menopause, which is why many screening programs start at 50. But we would recommend to start thinking about screening for breast cancer from about age 40 onwards, and that obviously depends on a lot of other factors that I guess we can discuss.
Yeah, and there's quite a big gap there between 40 and 50, so why the difference? What's different when you're looking at 40 and looking at 50?
Because we know one of the biggest risks for breast cancer is hormone exposure.
Right.
So at menopause, it's the woman's maximal lifetime exposure to hormones.
Mm-hmm.
So for that 10 years running up, we know that there are other risk factors that contribute to your risk, so we ask you to start thinking about screening. So these other risk factors could be if a woman smoked, so risk factors for breast cancer: if you smoke, if you have a family history for breast cancer, if you don't exercise as much, and if you're overweight. These are risk factors for breast cancer.
So you should consider starting to screen 40 to 50.
Yeah, that's right.
But from 50, it really is sort of recommended for everybody
Absolutely.
to get it done. And so what's the frequency? Tell me about the different screening programs and how often is recommended. What should we be doing?
So let's start from talking about from age 50 onwards and talk about screening in many countries that are offered. It's usually once every 2 years or even once every 3 years. That's in the UK.
Wow.
But I guess these are national screening programs.
Right.
If you start screening from 40, assuming you haven't reached menopause yet, we recommend that you do that screening every year. That's actually because once you start screening, you want to keep up with the screening program to know to keep up with the detection.
Yes,
increase your rate of regularly. But also, actually, breast tissue is a lot more dense premenopausally, and that's actually why we advise screening every year, because the denser breast tissue makes it a little bit more difficult to read the scans, so we should be doing that.
Oh, that's really interesting. I think I always assumed that from age 40 plus you were recommended to do it more regularly because the incidence was higher, but actually it's because it's just more difficult to detect.
Because it's more difficult to detect, and actually in your 40s we recommend that you have a mammogram, which is an X-ray, and also I normally recommend an ultrasound scan as well, because that actually specifically look for lumps. And when the breast tissue is quite dense, the X-ray, the sort of rate of picking up on an X-ray is a little bit less accurate, so we always have an ultrasound scan alongside.
Right, so from age 40 plus, if you feel that your risk factors are high enough, then you should opt to have it once a year.
That's right.
And I suppose your patient would come to you, talk through what those risk factors are,
That's right.
and discuss with you whether you think and they think that it's a good idea for them to expose themselves to that minimal radiation.
Yeah, that radiation risk is minimal, and we certainly, will not put too much emphasis on that. So how we normally assess that is to say, let's run through what your risk factors are. Do you have risk factors for breast cancer? And that's that's how we personalize that advice to your situation.
Yes.
So do you have a family history of breast cancer? Do you smoke? What's your weight? Do you exercise? Do you eat healthily?
Yes.
Have you taken hormone contraceptive pills, I guess, for a prolonged period of time? And then we'll discuss what that risk is and perhaps offer screening to these women.
Right, and then it's a question of doing it regularly, because once you've made that analysis, it makes sense to do that regularly. So that's formal screening, and I'm guessing that's kind of the best way to detect anything that might be there, because you're using the technology with healthcare professionals. What about self-exam?
Okay, so yes, self-exam is something that you would have probably heard about, and we ask women to do that. And actually, if you're examining your breast, we encourage you to do that once a month, normally around day 7 to 10 after the start of your period, where the breast is less tender and probably a little bit less lumpy as well. However, we know that breast self-examination, the statistics have actually shown that examination by yourself or even by your doctor, physical examination, it's not really going to increase the pickup rate for breast cancer. It's screening that's still crucial. However, what is very useful with breast self-examination is you get to know your breast. You get to know what it feels like. And actually you get to detect like breast pain, where actually breast pain is one of the important symptoms, common symptoms of breast cancer.
I didn't know that. I really didn't know that. I thought it was all about the lumps.
Yeah, I guess everyone thinks breast cancer is lumps, but actually thinks that breast pain is a symptom of breast cancer. So when you actually do your own examination, what you're looking for is also the appearance of the breast. Other symptoms like, what's the nipple looking like? Is there changes? Is there retraction where the nipple's going back a little? Is there a change in the overlying skin around the breast? There is a symptom where the overlying skin looks like the skin of an orange, and that's actually a sign of breast cancer as well. So it's not just lumps, there are all these other signs and symptoms to think about.
Yeah, and you mentioned pain. Is there a specific type of pain? Is it in one side? Is it an area like?
So the pain's often in the area and it doesn't move around. Okay. And the pain often may not go away even if you took painkillers. It may, but it's often consistent.
Okay.
And the pain, breast pain, don't get me wrong, breast pain is common in women through their monthly cycle.
Yes.
So I think we all may have experienced that at some point. But if that pain does not go away 2 weeks later, and it's consistently there, then that breast pain is something that you need to be more aware of. So often when you come to a doctor, for example, with breast pain, one of the first things we say is, let's keep a close eye on that. Let's see if the pain goes away in the next 2 weeks or 4 weeks, because that takes us through a different part of your cycle. If it does go away, then it's likely that pain is related to your cycle, the hormone changes, rather than breast cancer. But breast pain is definitely a symptom to think about.
Yeah, very interesting. So self-exam once a month. Get to know your boobs.
Absolutely. Yes, absolutely.
Know what they look like, know what they feel like, and just be mindful within yourself what's going on in your body. I think it's so easy to get caught up with life that we don't always look in within ourselves and check in with ourselves. If we are doing our self-exam and if we do find a lump, What will that feel like? And are all lumps cancerous? Is it something that we should be worried about if we do find something?
Actually, the first thing to say is breast lumps are common.
Okay.
They're common because of the monthly cycles that our body goes through, the monthly hormonal changes. So that's actually what causes these lumps to form. So if we were to scan every month, I think we're going to find a breast lump in pretty much a lot of women around. But most of these lumps are not cancerous. So actually the most common lump is something called fibroadenoma. It's a benign lump, very common in women in their 20s, 30s, 40s. So benign breast lumps are far more common. You can normally feel these lumps because they are bigger and you can actually feel them. But breast cancer lumps sometimes can be so small that you can't detect them.
Right.
Because then we're talking about screening. Screening picks up lumps that are smaller than a centimeter that can be quite difficult for us to pick up with our fingers. So if we're picking up a lump and you can feel it and you're checking your breast every month, quite likely that's a benign lump. Because breast lumps are actually common.
But would you advise to come in and get it checked out anyway?
Absolutely.
If you have any concerns?
Absolutely.
Just one symptom or more, keep an eye on it.
Yeah. Your doctor would be able to re-advise, how to keep an eye on that lump, how to keep a close eye on it, and what the follow-up would be.
Yes.
Yeah.
Okay. You touched on something just earlier, a little bit about HRT and the sort of link between HRT and it being a risk factor if you have been on the pill for a long time or taking HRT. Can you just talk about that relationship a little bit?
Sure. I mean, we certainly know that one of the causes of breast cancer is hormonally driven. So if you think about the pill and HRT, these are hormones. Theoretically, it does increase your risk or one's risk of breast cancer.
Yeah.
However, there has been there's been the Million Women study that's been published looking actually at the actual number of extra cases, and we now know we really need to look at the benefits. Talking about HRT, the benefits of HRT, where it protects your heart, it protects your bone health, it helps really relieve symptoms of menopause. Those advantages versus the risk, and I think it's certainly quite clear now that the risk benefits, needs to be taken into account. And yes, there is a slight increase in risk, but we need to look at the benefits as well. So I think it's best to sort of look at that on an individual basis because there are other factors that may contribute to the risk benefits.
Yes, it's adding everything up and it's looking at what's best for you because you can change your menopause management accordingly, depending on, So risk factors, we talked about what they are. What can we do to reduce our risk to breast cancer? Because those stats are really quite eye-opening. 30% of all new cancers in women are breast cancer. That's huge.
Absolutely. I think, for us, and what can we do is to not smoke. That's the first one. We know smoking increases the risk of breast cancer. Maintain a healthy lifestyle, a healthy diet, exercise, and keep a healthy weight. We know that also helps. And the hormonal part of that, I think we need to look at the risk benefits, but certainly in general, keep healthy, eat healthily, exercise, not smoke. And for the younger women out there is breastfeeding, we know, actually protects or reduces your risk of breast cancer. So if you're thinking of that and think about breastfeeding, that actually helps protect and reduce your risk as well.
Brilliant. So really, the message is that it's not just about self-exam and finding lumps. Screening is really, really important, but it's important to weigh up your individual risk factors and determine when is the right time for you to start if you're below 50.
Yeah, that's right. Speak to your doctor and we can certainly run through your individual risk profile and give you a very, a more sort of specific sort of advice.
And it's just a conversation. There's no hokey proddy tests or anything.
Not yet. And actually, breast screenings now, the mammograms now, are done in a hopefully in a more comfortable way. And there is slightly newer technology now with 3D breast screening versus 2D breast screening. So the technology's improved, and that will help pick up more cases as well.
Yeah.
So certainly screening working alongside that new technology.
Yeah, that's great. I've learned so much this morning actually about the various different symptoms and signs that we're looking for. I actually didn't realise that pain was such an important factor and can be present as an indicator. I think that's really important, and we'll certainly consider when to start and the risk factors, and start to spread that message amongst more women.
Absolutely.
It's really spoken about as much as it should be.
Yes,
So,
you know, it's talk about it, speak to your doctor, get the right advice, get the tailored advice,
yes.
and think about screening and
what's right for you.
What's right for you. Absolutely.
Brilliant. Thank you so much.
My pleasure.
That's been really
My pleasure.
fantastic. I'm going to put some more links about other resources that you can look at for information and other support online. Thanks very much for joining us today.